The joy of being a mother and a parent, baby pictures, baby smiles, the smell of a fresh baby after a bath, how a little one can light up a room and fill hearts with so much joy. Unfortunately, there are some ladies who experience a huge heartache of not being a mother. Each year, almost 4 million babies are born in the US, but for 10% of the female population, that is just a hope, a wish, maybe even a dream. Approximately 6.1 million women in the US struggle with conception, and statistics are showing that more and more of these women are turning to alternative methods and exploring holistic options when addressing their infertility issues. If you are watching this video, it's because you are looking for help. Hello, my name is Dr. John Heyer. I'm a holistic chiropractor, acupuncturist, nutritionist here in Frankfort, Illinois. And we've had many ladies, just like you, come to our office looking for answers and solutions. Our unique holistic approach to health helps rebalance a woman's body and prepare her to conceive. But let's start with you. You are likely one of two types of women who come to us looking for help. Either A, you are looking for natural methods to help with conception, or B, you may be thinking about in vitro fertilization and have heard that holistic therapies can increase your chances of success. And yes, they can. Let's address the natural approach first. You may be wondering, why are you having difficulties conceiving? Well, there are many possible reasons, some of which that can include hormonal and biochemical imbalances, energetic imbalances, and even structural issues. And we should mention that almost 50% of the time, it's not you. It's very possible the man in your life may be part of the problem. I know that may be hard on some guys' egos, but let's be gentle, and let's also be honest. Many men are just not making healthy sperm. Unfortunately, it's the female who carries the stress and unnecessary guilt on her own shoulders. So when you come in for your evaluation, bring your significant other with you, and we can determine if he should be evaluated as well. Now, what can you expect from an evaluation? We are going to evaluate you holistically, and what that means is we're going to look at your body chemistry, your body energy, and your body structure. Body chemistry. If you have already had blood or other lab work done, bring the reports with you for us to look at. If we see that there may be a test missing, we will most likely order it. There are some blood and saliva tests that are pretty standard for our needs, so we'll likely order those too. Body energy. We are going to measure your meridians. The electromeridian imaging, or EMI, is a test that evaluates excesses, deficiencies, or imbalances in your energy system and gives us a starting point from which to build. Think of it as we are measuring the battery of your car or measuring the battery of your body. If your battery is low, how can you have enough energy to conceive? Body structure. The nervous system controls every organ, tissue, and cell of the body, and if there is any nerve interference, it can cause dysfunction of organ systems like reproduction. Many times, we find misalignments in the lumbar, sacral, or pelvic areas that causes dysfunction of the nerves that control the ovaries and uterus in the female or the testicles in the male. These need to be corrected for normal physiological function. In other words, things won't work right with nerve interference. And I also want to be clear that I'm not treating the condition we call infertility, but in fact, I'm looking for the underlying causes that have created an imbalance in your body, which has made conceiving difficult. I believe if we remove these interferences, the body can heal itself. And it's an important concept to understand. So you're probably wondering, when can we start the treatment? Our evaluation only takes one day, but depending on how much is involved or if additional tests need to be ordered, it's common that we schedule a follow-up to give time for test results to come back and to prepare our report of findings. I don't want to waste your time. If I feel I can't help you, I have a network of doctors that I can guide you to. If I feel you are a good candidate for our program, the report of findings is where we discuss treatment recommendations. When ladies are trying for the more natural approach, we need to remember we are working with your natural cycles and you need to give your body a chance to heal and rebalance. Depending on the findings, we usually suggest the client mentally prepare for it to take between 9 and 6 months. We have seen results as soon as 3 months, or sometimes it may take 12. Now maybe you're the second type of woman and you are looking to do IVF, or maybe you've already tried that once or twice or even 3 times prior and you're hoping to improve your chances of success. Well, you're in luck because our methods work very, very well. Our evaluation is going to be the same as before, so please bring your reports with you and allow time for the examination. But in this case, the difference is time, and time is of the essence. Many women come with a retrieval and transfer date already set, while others are in the process of getting those dates set up. Preferably, we would like as much lead-up time to retrieval and transfer as possible. 1 month prior is good. More time is even better. Research has shown that this prep time helps prepare the uterus by improving the blood flow in the uterine artery, which improves reception of the transfer. In other words, it helps get the womb ready for the egg to live in. Now maybe you don't have that much time. Maybe you only have a few weeks or a couple of days. It's okay, we get it. Maybe you just heard about this and you're coming down to the wire. I completely understand. I also have good news because there's research that shows acupuncture treatments 25 minutes before and 25 minutes after transfer can improve success rates by 26 to 42.5%. Since there's usually drive time from our office to the fertility doctor's office, we suggest at least the day before and the day after. But again, more time to prepare is better. Please keep that in mind. I know that no conversation is over until we talk about the finances. We've intentionally kept our fees reasonable because we know that most insurances have little or no coverage for holistic therapies. No insurance covers nutrition or nutraceuticals. Acupuncture is usually not covered either, and most insurances have some or little coverage for chiropractic. We will call your insurance company on your behalf and verify your benefits and discuss financial options with you. So what comes after? Women come to us for other reasons for more than just conception issues. Some ladies can get pregnant, but come to us because they cannot carry full term on their own. It's common for ladies to use our services throughout their pregnancy to help keep their energy up and also help with the aches and pains of a growing body. And I've had the honor of helping some initiate labor. One of my proudest moments in practice was a few years ago. A young lady came to us because she was having difficulty getting pregnant and she wanted to start a family. Her husband thought she was nuts for starting care in our office, but in her words, she just had a good feeling about this place. She went through our program and I hadn't seen her for several months. And one day, at the end of my morning shift, I was about to get ready to leave for lunch when I saw a woman walking up our sidewalk, and she was carrying something in her hands. I didn't immediately recognize her, but she looked very familiar. It was that same young lady, and she walked into our office and set a baby carrier down on our front desk. And with the biggest smile on her face, said, "Hi, Doc, look what I got." Well, let me tell you, you couldn't wipe the smile off my face for at least a whole week. And I'd like to help you too. I look forward to helping you with your success. Thank you.
Hi, my name is Amanda. I'm here to talk a little bit about my story, and that happened to be with infertility. So I had gone to the doctor, been diagnosed with unexplained fertility issues, and my husband and I certainly wanted a child. So we had gone through IVF, and the first round we wanted to do everything we could. I did end up seeing an acupuncturist that was a little different. I felt like I didn't know much going into it. They had wanted to suggest doing one session right before the IVF cycle, and I did go through that, but unfortunately it did not turn out the way we wanted. It was unsuccessful and did not develop a pregnancy. So I did have to do IVF a second time. So with that knowing, we wanted to do everything we could. I did investigate from some friends a little bit more into acupuncture. Obviously, a lot of people don't know if it's just their bodies and it's just going to happen. Others, I think, do look into, what we would say the unconventional methods, different things to figure out, can we help and get the successful pregnancy we're looking for. So I did decide, I do believe in the acupuncture. I wanted to find out a little bit more, but maybe with a different practice. So I ended up here, really happy with what the doctor told me as far as how he explained it. He looked at me, did a few tests, and said, yes, we need to do acupuncture, and this is why it will help you. And it was way more than just one session. That's what I do think the difference was. There was multiple sessions that really were involved, and I felt comfortable the whole time. And then, something must have gone right, because then the second round of IVF, we did end up with twins. So we're happy to say I have almost 1-year-old twin boys and couldn't be happier, certainly with the staff and the service here.